Hello, I'm Rona Kramer, Secretary of the Maryland Department of Aging, back to bring you an update on COVID-19. I am bringing these messages to you because I want Maryland's older adults to be continuously updated on our state actions. I also want to share the information that we are learning as we traverse this new territory. What's changed over the past week? Though we have more cases of COVID-19 in Maryland, many people have also recovered. Sadly, we have had a number of deaths. The governor has ordered the closing of more establishments and reduced the convening of allowable groups to 10 people. But be honest with yourself. If you are in a group of 10 and 9 of them could make you sick, why risk it? Governor Hogan and his team are meeting mostly by conference call, but all day, every day, 7 days a week to prepare Maryland for an increase in cases. In addition to putting off elective surgeries, Maryland is creating or making available additional medical facilities to deal with a surge in patients should it become necessary. Our Maryland team is obtaining and storing supplies. We've prepared vehicle emissions inspection stations for drive-through testing and have begun caring for children of medical providers who must be at their jobs. We are delivering 28,000 meals per week to seniors who are part of their senior center congregate meal programs. We are feeding all of the school children who received free and reduced meals at school. The list is extensive, and some of the greatest minds in planning and execution are on the job here in Maryland. So, what should you be doing? We know that COVID-19 spreads like a cold or flu through coughing and sneezing. So, in order to stay healthy, stay at home, if at all possible, without visitors. Do not kiss, hug, or handshake. Anyone who enters your home, including you, must wash their hands for a full 20 seconds before doing anything else. Otherwise, the virus will transfer to places that you'll end up touching later. If you go to a store or pharmacy, and it's better to have someone do it for you, go when there are no crowds. Even a week ago, I drove to the grocery store, saw the busy parking lot, and drove right past. While we're talking grocery stores, please don't panic purchase. There's no shortage of food, toilet paper, or other supplies. You're seeing bare shelves because an entire country is overbuying all at the same time. The stores are restocking and will continue to do so. Given a chance to hire more delivery drivers, I bet they'll be back in the delivery business very soon as well. You should certainly cancel travel if you haven't. No cruising. Even U.S. river cruising should be canceled. Sanitize with commercial cleaners all of the high-touch places in your home frequently. As a quick reminder, those high-touch places include doorknobs, all of them, remote controls of all kinds, faucet and refrigerator handles, light switches, all of your phones, computer keypads, handrails, commode chair rails, wheelchair arms, grips and brakes, even your pill boxes. And please, very importantly, remember to sanitize the grips of your cane, your walker, or your rollator every time you wash your hands. Otherwise, your hand washing will have been in vain. Wash your hands again after putting away groceries, touching mail, which, by the way, should not be put down on your table. Put a paper towel under it. After touching anything else from outside, sneezing, coughing, or blowing your nose. Other tips: don't get into an occupied elevator. Wait for another one. What do you care what they think? Determine who can provide you with care if your caregiver gets sick. Keep a complete list of all medicines and supplements on your refrigerator or in your foyer. Don't be afraid of being outdoors. You just don't want to be outdoors where you'll be within 6 feet of others. Get as much fresh air as you can. If you should touch anything while you're out, use your hand sanitizer. Better yet, just don't touch. What if people around you get COVID-19 or you feel sick? A fever is a good indicator. Monitor yourself and look for fever over 100.4 degrees. Pay attention to, again, fever, coughing, body aches, and shortness of breath. If you're feeling sick, first stay away from others and call your primary care doctor. Please do not go to your doctor's office without calling first. Many doctors are using telehealth, so you might not even need to leave your home. Maryland primary care doctors are on update calls with our infectious disease specialists regularly, so they are prepared to handle this. They will advise you as to the next steps. There will be an increase in cases in Maryland. We know that. But by being vigilant and following this advice, you'll not only reduce the risk that you will get sick, but you'll be saving many others as well. I want to show you a chart that truly explains how each one of us can make an amazing difference to Maryland's outcome in this. The impact that every one of us can have is nothing short of phenomenal. Most of you have already seen the graph that shows how vigilance and social distancing now will pay huge benefits later. Governor Hogan has given us the best chance of flattening that curve in Maryland by reducing contact quickly, decisively, and early. But each of us needs to play our part. That does mean making sacrifice for the good of our community. This pandemic will take us some time to get through, so we need to maintain our strength by eating healthfully, drinking lots of water, getting exercise, and supporting our mental health. Take an online course offered for free. There are many online relaxation supports. Whether it's meditation or comedy that makes you feel better, be sure to indulge in it. No, chocolate ice cream is not on the indulgence list. Turn off the news for a bit. Call friends and family just to chat. I will continue to keep you apprised right from the heart of your state government. And remember, Maryland is the first state in the nation to start a free, opt-in telephone service to check on Maryland's older residents, and it's called Senior Call Check. Call 1-866-50-CHECK or register online for a daily check on older adults. Additional information is always available at coronavirus.maryland.gov. Until then, don't forget to laugh. Place a call to someone who might be lonely or scared. Remember, as Governor Hogan says, we are all in this together, and we'll get through it together. Until next week, stay calm and wash those hands.
Use your head, slow the spread. Brought to you by the Maryland Departments of Health and Aging. Visit coronavirus.maryland.gov for resources and information.